name is Nathan Boykin, and this is my presentation on chronic traumatic encephalopathy, also known as CTE. CTE is a neurodegenerative disorder that mainly is caused by traumatic injury to the brain. So this can be repeated injury, or this could be having one substantial injury to the brain, and it's typically something that progresses over time. So CTE does get worse. What I'd like to go over in this presentation is what is CTE, what causes CTE in the brain, physiology of CTE, testing, diagnosis of CTE, who is affected by CTE, prevention of CTE, and potential treatments for CTE. So unfortunately, CTE, when it occurs, is very hard to diagnose in people. In fact, you cannot diagnose CTE fully on a living patient. This is because you can't really see the brain on a living patient. So when all the studying and stuff that has been done on CTE is done post-mortem through autopsies, and you're able to see what's really going on inside the brain there. And a lot is not really known about CTE because there's not been a ton of research done, but a lot of this is speculative, and hopefully as more research is done, we can know more about what is going on in the brain and how to prevent and maybe treat those later on. CTE is a neurodegenerative disease, and it's progressive, like I said. So when it is first you're starting to see signs and symptoms of CTE, usually it's presented as, maybe some mood changes, depression seen a lot in CTE, memory loss, cognitive ability, definitely people who struggle with being able to do physical activities that they might have been able to do before, behavioral issues. We've seen this a lot in the news where they talk about with athletes and potential relation to CTE when people have committed suicide, or maybe certain things have been going on, and we see, especially with NFL players, we've seen this a lot. So I'm kind of going to break down what different stages are. So CTE is really recognized at first with your mild stages, and that's typically your 1 and 2 when you're seeing these mood changes and stuff. The severe CTE, your stage 3 and 4 on the scale, is when it starts becoming related to Alzheimer's, early dementia, signs that kind of mimic Parkinson's disease. So this is related to CTE and these disorders like ALS and Alzheimer's, all having what's known as tauopathy. So tau is a protein in the brain that is thought to play a key part in CTE, but also Alzheimer's. And tau is a protein that protects the neural pathways, which is your neurons and axons in the brain. So when somebody has brain trauma, it is thought that there is release of GSK, which is glycogen synthase kinase 3, in the brain, and that contributes to the breakdown of tau. And so these tau deposits in the brain are created, and they try and protect your axons and your neurons. And then the GSK3 tries to stop the breakdown of that, which can cause deposits of tau. And so these deposits of tau create these neurofibrillary tangles, which is also seen in Alzheimer's as well. And so these tangles are kind of a telltale sign of something going on there in the brain. And so this is kind of what's suspected. Now, not every time that this happens, there is a what's known as RTK, receptor tyrosine kinase, inhibits GSK from causing more substantial breakdown of tau on neural pathways, but it can only do so much. And so that is, I'll get to that later on in this presentation of there could be some potential treatment with that, but again, all of this has not been studied enough to know if this is fully what is going on to cause this disease in the brain. Now, once you start looking at your neurons and your axons, they all play into communication in your brain, and that's why it's speculated that's why you're seeing a lot of these signs and symptoms, because the brain is having trouble communicating with different areas. So with all this breakdown, so some physiology of CT in the brain. So you're typically seeing a lot of shrinkage. You're seeing some increase in the ventricles of the brain is a telltale sign. When they examine, you're seeing some more spaces in the gray and white matter is another sign of CTE. When we're looking at the physiology of the brain. So again, these changes are not something that we can see in a living patient. So again, these are seen once somebody dies and their brain is there's an autopsy and the brain is studied. So that's unfortunately, and that is a sad part of CTE. So some potential for diagnosis and testing on a living patient typically comes from like what can we see going on in this patient. So like the signs, symptoms of CTE, your depression, mood, behavioral changes, loss of cognitive function. All of this stuff can be potentially treated, and you're kind of treating the symptoms here. But it's hard to diagnose somebody with CTE. So a good medical history of the patient and of what brain trauma has happened in the past can all play key roles in helping doctors diagnose and try and treat and maybe create treatment plans for these patients. At the moment, there's not a way to get imaging of the brain to see what that looks like, to see what CTE is doing in the brain. This is something that potentially later on, maybe you could get an MRI or a CT scan of the brain and be able to see what is going on in relation to CTE. But at the moment, that is something that is not able to happen, and it is sad. It's just sad fact that you can't diagnose this on a living patient fully. And a way to is diagnosis. Families typically are seeing these things progress worse and worse in people that have CTE. So it is something that they can help with watching out for in these populations that are affected. Again, this is another slide of normal brain and a brain with advanced CTE. Who is affected by CTE? CTE is most prevalent in athletes of contact sports, so football, boxing, soccer, hockey, the greatest risk. CTE has been noted for decades. There's articles came out back in the 1920s that talked about what was known as punch drunk. They call boxers that were hitting the head quite a bit, and you'd see reports of those boxers later on in life having signs of Parkinson's disease, early onset dementia. So this is not a new thing. Now, a lot of the more notable cases that we've seen recently and that we've seen on the news and stuff have been related to NFL. So there's a lot of studies that have been done of patients that have had thought to have had CTE, and their brains have been examined later on. So 80%, 87% of the brains donated to be researched on for CTE by former NFL players have shown signs of chronic traumatic encephalopathy. But it's not just NFL players that can show signs and symptoms and potentially have CTE. They're really, football is a great sport, but also a sport that can cause CTE in players. So, additionally, outside of athletics, military personnel, especially these combat areas, have been seen to have traumatic brain injuries from explosions, and there's thought that this could also be a population that is at risk for developing CTE. Prevention of CTE starts with educating players, families, organizations, like giving our soldiers and athletes the right equipment to fully absorb some of these impacts, to reduce the amount of trauma in the brain. Talk about athletes. A big thing now is kind of talking about how to tackle properly and and how that could prevent how you hit your head when you when going into when playing these sports is a big thing. And they're limiting the amount of time players are susceptible to such hits. So a lot of organizations now are going into kind of reduced practices or practices without pads or tackling, and doing more of walkthroughs to reduce the amount of time somebody could be hit. Again, the amount of research and funding on this has been limited, and it's something that hopefully with more research we can know more about how to prevent CTE from occurring. Potential treatments of CTE plays into what I was talking about with regards to tau and GSK when I was talking about in the beginning of the slide. There is thought that kinase inhibitors to target GSK3 in the brain could potentially have some treatment for reducing the breakdown of tau and the creation of NFTs in the brain. But this is, as seen, there's been no clinical success in doing this. So at the moment, there are no current treatments of CTE. Conclusion: CTE is a fatal disease of the brain. There is no known treatment for CTE. There is no way to diagnose CTE. There needs to be more research done on the prevention and treatment of CTE. Thank you for your time. I hope you gain a little bit more knowledge on CTE.